Talking about management, do you think it is a good career choice for medicos, like to probably do an MBA or MHA or something like that?
So there are advantages to both, and again, it largely depends on what you want to do.
Apollo has a DNB program.
The reason why the DNB program was initiated in the country was a belief that there's a lot of opportunities for training and teaching in the private sector.
In a lot of government hospitals, trainee is left unsupervised.
So what you need is a mix of someone mentoring you and the right volume exposure, and it is the combination that makes a big difference.
There is a dark side to the residency, and there have been some reports of suicides as well.
They came to save lives, but some couldn't save their own. Suicides in hospitals are on the rise.
Hello everyone, welcome to Delli Docs, जहाँ white coat सिर्फ कहानी की शुरुआत है. Our today's guest, Dr. Anupam Sibbal, is a pediatric gastroenterologist and also he's the medical director of the group of Apollo hospitals. So let's quickly dive into the podcast and ask him, sir ने कैसे किया, and also what we can learn from him. Thank you, sir. Thank you for coming to this podcast.
Pleasure, Naman, to be a part of your show. Thank you.
Sir, you are a senior pediatric gastroenterologist, but you have also a very senior administrative post. You are the medical director of not just this hospital, Apollo Delhi, but actually the entire group of Apollo hospitals. Sir, how did this transition happen? Was this always in your mind?
Well, not really. I'm a clinician at heart, and when I did my pediatrics, I wanted to train in pediatric gastroenterology and hepatology, so I went to the UK. At that point in time, there was no training for pediatric subspecialties in India.
Okay.
Neonatology had just about started.
What year are we talking about?
We're talking about, I left in 95. And the idea was to come back and help set up a pediatric liver transplant program in India. There wasn't one. And that's how I came to Apollo, had an interaction with our chairman, Dr. Reddy. 97 I joined. 98 we performed the first successful pediatric liver transplant in India.
Okay.
And we started doing clinical work. Pediatric gastroenterology and hepatology was established. We started getting referrals from within different parts of the country, overseas. And then in 2002, I once had an interaction with our chairman, and I mentioned to Dr. Reddy a few suggestions on how is it that we could look at doing things differently at Apollo Delhi. So chairman, being chairman, is a very patient listener, and of course he gave me a lot of time. And after that he said, okay, thank you. I've heard carefully all that you've said, and I shall come back to you. And a few days later he came back and he said, I thought about all that you said. If you believe that those changes are going to make a difference, why don't you give it a shot? I'm going to appoint you as the medical advisor of Apollo Delhi. Okay. And that's how the transition happened. And then in 2003, when I was not yet 35, I was appointed as the medical director of Apollo Delhi. And that's how, this administrative role, which I had not planned for, panned out. And then in 2008, I became the group medical director, which was a new position that was created. And one of the things that we discussed at that point in time with Dr. Reddy was on how does one balance clinical with admin. And he had a very, very clear answer. And he said, I used to see patients till well into my 70s. And I managed my time. So it's really up to every individual to decide how they want to manage their time. There are people who do research, are very active in academics and do clinical work. So you manage your clinical bit and you manage your administrative bit. And that's how it's been.
There was no MBA, MHA, nothing.
I had never planned on doing a hospital administrative position as part of my plans. So hardcore clinician, administration happened. And I think it's been a wonderful mix in terms of administration and clinical provision.
So are you still in touch with your pediatric?
Oh yes, absolutely. I manage both, and the hospital's been extremely supportive. Dr. Reddy, Miss Preeta, Miss Sunita, Miss Shobna, Miss Sangeeta, who run the Apollo Hospitals group, have been very, very positive about the benefits that come when you actually keep abreast of what's happening in clinical medicine while you have an administrative position.
So, talking about management, do you think it is a good career choice for medicos, like to probably do an MBA or MHA or something like that?
See, it largely depends on what you want to do in life.
जी
Now,
sir.
people choose medicine for a variety of reasons. Some people choose medicine for the love of medicine. Some people choose medicine because they want to innovate. Some people choose medicine because they want to bring in cutting edge technology. They want to develop new ways of treating conditions. Some of them want to become doctors because they want to teach the next generation. And there are some who want to administer hospitals and want to bring in the best from other industries into healthcare. So it largely depends on what you want to do. The answer is, if your heart desires it, then plan for it and have a roadmap, and then go according to the plan, and hopefully you will get a good position that will help you make a difference.
But the chances are good if
Well,
to get
absolutely.
a
Healthcare is expanding a lot. So
Right.
there are tremendous opportunities for doctors to become healthcare administrators. And it would be good to have a degree,
Right.
whether it's an MBA or an MHA. If you do an MHA, of course, it's pertaining only to healthcare. If you do an MBA, then it would be about business in general. So there are advantages to both. And again, it largely depends on what the person concerned visualizes in a 5-year, 10-year, 15-year horizon. So you might have a doctor who says, listen, I'll do an MBA because tomorrow I might want to go into biotech, or I might go into
Acha,
health
makes
IT,
sense.
or I
Right.
might want to do something in pharma in addition to hospitals.
जी.
But you might have someone who says, no, I only want to work in hospitals. And then perhaps an MHA might be better. So largely depends on what your goal is. But what is very important in life is to be very, very clear on what you want to do, and then make a roadmap based on that goal.
So what kind of job he lands into, like as the first job after doing these degrees?
So it depends. It depends on how much experience you have, what kind of a degree you have.
Okay.
See, for several MBAs now, you have to have work ex. So, you've done medicine, you worked for a few years, then you do your management degree, and then you come back
Okay.
with some work ex. So then you'll be at a different position. If you've done your MBBS and then go ahead and done your MBA, you don't have any work ex, the position will be different. So these would largely be positions in medical administration or in ops. I mean, some people choose to get into finance as well, and healthcare financing is a very exciting area as well.
Okay.
So depending on the skill set, experience, qualifications from where, the opportunities will open up. Also the flexibility at a young age to be outside the metros. There are tremendous opportunities outside metros. So if someone is willing to do, go and explore smaller towns and living there for a bit, that also opens up opportunities. And then, you go up the ladder.
Okay, because the big hospitals are coming up in these towns.
Absolutely.
Right.
There are so many cities with a population of more than 10 lakhs now.
Ji,
And
sir.
all of them now are seeing healthcare of a higher standard coming in.
So let me take back to your clinical side. So straight question, why did you choose pediatrics?
Well, pediatrics were very fascinating when, I was an intern, because what was very interesting is that a child doesn't really tell you, or can't really tell you, a young child can't really tell you what's going on.
Right.
And so, you have to use your clinical acumen. You have to have a good sense of observation. And that's really what got me very interested in pediatrics. And then, to get a smile back on a child who's come to you in pain and distress, and not just the child, the family,
whole family,
the parents,
right.
the grandparents, everybody, getting that sense of satisfaction that things have got better was very gratifying. I chose pediatric gastroenterology because I really wanted to subspecialize, because I believed that the time had come for subspecialization in pediatrics. Gastroenterology also provided opportunities to do interventions. And then, of course, liver transplantation ended up becoming what fascinated me the most, and that really became the goal.
So you had a clear goal in mind probably, and a clear path at least. But so there are a lot of students who really don't know which branch to pick.
Yeah.
So do you have any words of wisdom for them?
Yeah, it's a difficult call because, so I think I was very clear during internship that I wanted to do pediatrics. In the first year of pediatrics, I was very clear I wanted to do pediatric gastroenterology. And before I embarked on a fellowship in pediatric gastroenterology, I was very clear that it's going to be pediatric liver transplantation and establishing it.
That's great.
So luckily for me, it worked out very well. What the plans were panned out. But it can be difficult. So I think the question that any young doctor needs to ask herself or himself is, listen, am I going to be happy doing this for 20 years, 30 years of my life, or 40 years of my life? Or is this a passing fancy? I am scrubbed up in the OT,
Right.
getting very enamored of minimal access surgery. But is that something I want to do? Or is it something that I want to focus on in terms of interventional radiology because I feel that, interventions are exciting? Or is it something where I want to think more, analyze more? I want to do a medical specialty. Do I like to do interventions or not? What kind of a lifestyle do I want? Am I willing to be woken up every night for the foreseeable future? Am I willing to take the pressure of getting into a specialty where you can lose a patient? Am I willing to cope with complications that will ensue with interventions, with procedures, with medications, in
Probably
complex
litigations also.
So you have to decide, and it's a call that you have to take. There isn't one specialty or two specialties that I say, stand out in terms of others. It is really about something that you must enjoy doing. It must be that you come to work and say, hey, listen, I'm excited and I'm going to make a difference. And it shouldn't really be work. It should be enjoyment. Because if it's going to be work, then you're going to look forward to, when do I take a break? But if you love what you do, then you don't need a break.
And I also think, sir, probably during clinical rotation, it helps to talk to the real senior professors.
Absolutely. Talk to people in your chosen line who've got 5 years, 10 years, 20 years, 30 years experience. Try and visualize what you would be like when you're 50 years old.
Right.
And say, listen, will I be happy doing this?
Sir, Apollo has a DNB program. Sir, can you tell key differences between DNB and an MD MS program?
So initially, when the DNB program started, and the reason why the DNB program was initiated in the country was a belief that there's a lot of opportunities for training and teaching in the private sector.
Right.
And because these private hospitals are not affiliated with universities, they can't have a MD or MS, DM or MCH program. And over a period of time, it was found that a lot of newer subspecialties that were emerging, it would be possible to train in the private sector. And that's why we at Apollo, for example, now have accreditation in 56 specialties in 24 hospitals. We have more than 1,300 seats. 4.4% of India's DNBs train at Apollo. So Chairman had this vision when Apollo was established that it should be about clinical care, it should be about academic excellence, and it should be about research. And over the last 20 years or so, we've invested in terms of developing an ecosystem where our Apollo education vertical is very strong. We have a university, we have 2 medical colleges, we have 11 schools and colleges of nursing, hospital administration institute, physiotherapy institute,
Right.
and now 4.4% of India's DNBs train with us. Is there a difference between MD, MS, MCH, DM, and FNB and DNB, super specialty and DNB? In terms of training, no. In terms of equivalence, there is no difference. If you apply for a job, say in an academic institution, there's no difference. The difference only comes in if the institution doesn't have the volumes and you are in a specialty where interventions are important, where surgery is important, then to be able to build that, the institution must make extra efforts to allow hands-on exposure. The advantage in a private institution is that there's going to be someone holding your hand, and I think it's extremely important to have someone hold your hand because then you can learn from that person's experience. But the volume has to be large enough for you to be able to get exposure, and that's why we've been very particular in that we only apply for the number of seats based on the volume that we have, because we believe that we should only have the requisite number of trainees where the exposure is significant.
Yes, that's a very important point, because in a lot of government hospitals, you might also be knowing that the trainee is left unsupervised, but I'm sure that's not the case.
But there is a lot of exposure in terms of volumes in the government setup, which of course is very important. So what you need is a mix of someone mentoring you and the right volume exposure. And it is the combination that makes a big difference.
So you also appoint a lot of doctors for various jobs. When you have a CV, what skills do you see before appointing him as, let's say, a junior consultant?
See, it's extremely important that all our young doctors realize that the ground realities are very different to say my time when I came back in 97 to now. What has changed? While there are tremendous opportunities and healthcare facilities have increased pan-India, subspecialization, super specialization, infrastructure, technology, all of that is available. We're actually producing a fair number of doctors. Now, going forward, we'll be producing 107,000 MBBS doctors. The ratio of PG to UG is about 0.7, but we believe that ratio is going to become 1:1. So there are going to be 107,000 postgraduates that are going to come out. Now, if you're an anesthetist, for example, and the year you graduate, say from an MD anesthesia or a DNB anesthesia, there are going to be several thousand anesthetists who will also pass out. A significant proportion of them will do a senior residency in the private sector or the public sector for 3 years.
Okay.
So everybody will have the same qualification, they'll have 3 years of experience. So what is special about you is a question that every medical student needs to ask during MBBS, not during internship, not during PG, not during your senior residency, but earlier.
Okay.
What is special about me? Is it going to be my knowledge? Well, the knowledge base is going to be pretty similar. So what is it that you'll do extra? Will you do some extra courses? I know it's very hard. You can't really do that during your MBBS and PG, but later on, will you do something online? Will you stand out in terms of academics by actually making an effort to present oral papers in conferences at the hospital level, at the city level, at the state level, at the national level, at the international level? Would you excel by publishing case reports to start off with, and then move on to reviews and papers? So if your CV can demonstrate that you are interested in academics and research, you've published papers, you presented, definitely that carries more weight. Have you made efforts to acquire more skill sets than your peers? That will help. Or is it going to be that you are an absolutely industrious doctor and anyone who is your referee says, wow, the way this young doctor treats patients, the way this young doctor connects with families is like awesome. I've never seen someone feel so energized when they're looking after a patient, and I have never seen the family respond so positively to this doctor, which means that there's so much empathy. There's a connection. Medicine is about connection. So maybe your CV stands out and you have that power in you. You have that ability.
Letter of recommendation.
So you have that kind of a skill set. So what you have to ask yourself is, how is my CV going to be unique? How is it when a person's looking at my CV says, wow, this is exceptional. So work towards making your CV unique. It should talk about who you are, not just an MD or a DM.
So you did a lot of fellowships from UK and prestigious degrees as well. Does a broad fellowship help?
Well, I think times have changed.
Okay.
If you go back to 2 decades before I went, things were different. My generation, things were different. For the present generation, you don't really have to go abroad. You have to value very carefully what is it that you get by going abroad. Many of us went abroad because those training facilities were not available. And then we wanted to work in our country, be a part of our community, so we came back. Some, of course, did not because they found good opportunities there.
Right.
But today, you don't really need to go abroad for training because all those facilities are available in the country. Yeah, it can be competitive, it can be hard to get there, but you should have a very, very clear reason on why you want to go abroad. And I do not believe that when we review CVs, that we worry about, do you have those foreign qualifications or not? It doesn't matter. We have a great sense of pride in training programs in India. We have a great sense of pride in how, clinical training happens. And we believe that there isn't really an opportunity, there isn't really a need for someone to go abroad, but you really have to have trained in fine institutions and be able to demonstrate that you are well trained.
So taking back to the questions about management, sir, can you walk us through the administrative structure in Apollo? How do you manage it consistently across a vast network?
So basically, all the hospitals within the Apollo system have a unit head who could either be a a CEO or a chief operating officer. It depends on the size of the hospital, the location, what is the structure of the company. And then, of course, there is a finance head, there is an operations head, there's a medical head, there's a nursing head. And under the operations head would come all the other divisions: biomedical engineering, F&B, security, housekeeping, and so on. Under medical would come all the medical, which would be all the clinical services you provide, lab, radiology, and then the junior medical staff. And if you have a training program, then you'll have the whole education piece with fellowships and D&B. Nursing in some locations report into medical, in some they report into operations. And then you have a system of regional leadership, because we are a very large network. And then, of course, you have the corporate functions where there's a head of HR, medical, finance, operations, legal, and so on and so forth. And then, of course, we are fortunate to have, Dr. Reddy, who's a clinician, lead the Apollo group. So that's how really the structure's been built over time.
So you have been with Apollo for 2 decades now, or maybe more than that. So can you tell us some behind the scenes inside story, some interesting bits about Apollo?
So I'll be completing 28 years at Apollo in a few weeks. And it's been an absolutely amazing journey. And the reason for that is the way Dr. Reddy thought of Apollo, the way he created Apollo, the way he's built Apollo. And what has been very interesting for many of us who've been here for decades is interacting with Dr. Reddy. For example, of course, humility, and he's an exceptionally humble leader, is the positivity with which you end up in every single interaction. You go to Dr. Reddy with an idea, he will hear you, and he will ask you questions about it. And there's a very strong likelihood. In fact, I would say there's an upwards of close to 100% that he will say yes to that idea. And then he will say, okay, how do we do this? Maybe we need to tweak this slightly. Do you want to think about this idea? But the answer is always a yes. It's never a no. And I think that is really what has made it very exciting for us. Second thing about the way Apollo has been structured is that it's always been about the country. It's always been about scale. So Dr. Reddy never believed in buying hospitals, because he said, how does that help the country? We need to build. It's not about changing the board, the logo on an institution. The country needs more facilities. So our ethos has been about building. What has also been very unique about Apollo is the whole concept that Dr. Reddy brought in about how do you treat families. And in fact, in all the orientations, he would mention to everyone who was joining the Apollo family that whenever you're treating a patient, think of that patient and treat that patient just like you'd want a family member to be treated. Your parent, your sibling, your spouse, your child. Do nothing more, but please don't do anything less. So just like you would want a family member to be treated, make sure that patient is treated. Nothing extra, but nothing less either. And that's really what has resulted in Apollo being as successful as the group has been. And it's just that the culture, the fabric on which we've been built, the ethos.
So during this career, do you have any defining moment that really impacted or changed the direction of your career?
Well, I think the first was that joining Apollo to help set up the liver transplant program. The second was when we actually pulled it off. The third was that interaction with Dr. Reddy when he said come into admin. And after that, there have been so many, like, should we get accreditation, international accreditation for Apollo? That journey started in 2003, 2005. Apollo Delhi became the first internationally accredited hospital by Joint Commission. It was the first in India and the fifth in Asia at that time. And then there were so many things about developing clinical balance scorecards, getting into academics, starting Apollo Medicine, expanding D&B, looking at telehealth. There have been so many exciting opportunities that one has been a part of, and one has been a part of the team that has been charged with developing new ways in terms of caring for patients, looking at how medicine is delivered.
So these are the success stories, and we can go on about them. But you also know that there is a dark side to the residency. A lot of the residents are depressed during the residency. They feel burnt out. Not just residents, even the senior doctors sometimes do that. And there have been some reports of suicides as well. So, what do you have to say to a guy or a resident specifically watching this podcast at probably late in the night, feeling overwhelmed, depressed?
So, first of all, I think you're very privileged that you are in the medical profession. Name another profession where you have the ability on a daily basis to take someone's pain away, to bring back a smile, to take someone's worry away. Which other profession can do that? So, you're blessed. Thank your blessings that you are in this profession.
Right.
What you do each day is God's own work. You are the chosen one. Remember that, you'll feel a lot better. Second, you might be in a particular specialty. You might find it very taxing. Think about how is it that you can get the work-life balance right. There are people who can survive and thrive with 5 hours of sleep, and there are people who need 8 hours. You don't have to conform to what's happening around you. Your body is unique. All 8 billion of us have our own DNA.
Right.
We have our own unique genetic makeup. The same medication reacts differently in two individuals, right? So we need to realize that each one of us is different. What works for your colleague might not work for you. So decide what works for you. You don't have to be proving this to everyone all the time, that I'm the perfect colleague, I'm the perfect resident, I'm the perfect registrar, I'm the perfect consultant. You don't have to. That takes some of the pressure away.
Right.
And everybody's under pressure. So, the fact is that if we say the pressure is going to go away, it's not. There's going to be pressure of performance, there's going to be pressure of exams, the pressure of publishing, there'll be later on, professional pressures of excelling and so on. But you have to learn how to feed off pressure. Don't let the pressure feed off you. Learn how to feed off pressure. Have a buddy. Have someone you can offload. There might be a colleague, there might be a senior, there might be someone in the family, there might be someone from the non-medical field you can offload on and actually talk about it. And when you're getting overwhelmed, talk about it. Talking to a counselor, talking to a psychiatrist, and I know there's a huge amount of reservation in our country to do that. Please do that. What is the big deal? That is why there are professionals who are meant to help you with that. Do not remain bottled up. If you're finding something that is toxic, try and figure out how you can remove that toxicity from your system. And the toxicity could be driven by what you consume in terms of food, in terms of what you drink, in terms of your habit, in terms of what you see, in terms of who you hang around with. There are so many different ways you can get toxic exposure. So you have to decrease the toxicity. And you have to remember that who you will be 5 years from now is determined by the books you read and the company you keep. And when I say book, I mean, I don't mean a physical book. It could be Kindle. It could be whatever way of, you communicating with the world in terms of enhancing your knowledge, not just about medicine, about life. But it's extremely important to keep company that is positive, that actually lifts you, that doesn't pull you down. Company that makes you feel valued for who you are, not undermines who you are. So it's extremely important to have a support structure.
Well said, sir. So, talking about communication, do you have any tips to improve the art of communicating with the patient?
I think it's extremely important to try and become a student of becoming a better communicator. And I say a student because this is a lifelong journey. The first is, you have to be calm, you have to be composed, you have to be super patient. It typically takes about 18 seconds for a patient to describe their presenting complaint, but there is enough data to support that doctors usually interrupt them in 12 seconds. So even if they just listen for 6 more seconds, I think you'll have a better connect. So you have to listen. You cannot be impatient. You have to say the same thing sometimes 10 times over. You have to sometimes say the same thing to many relatives, because in our culture, relatives play a very important role. And you say, I spoke with this person and I explained it, go ask him. But he'll be lost in translation. You have to explain it. You have to be a deep listener. You can't be looking at your phone thinking about the next thing while you are actually talking to someone. You have to look at them. You have to engage. You have to ask questions that are relevant. You also have to learn a little bit more about the patient and their background, which might be very relevant. You also should find the time to learn about some of their interests, some of their worries. Listen, whoever comes to us is stressed. They are not coming to us in the best state of mind, right? So we have to keep that at the back of our mind. This is not a pleasurable, joyful, experience in terms of coming to the hospital. You can make it very pleasant, but when they're coming in with a sense of concern and worry. So what is it that I can do as an individual to make sure that the patient I'm interacting with, and very importantly, the family, is more comfortable? So, there are finer points that one picks up over a period of time on how to communicate. You should read a little bit about how to communicate better. There are some excellent tools available.
So this is a question from my personal experience. So sometimes I'm faced with a lot of not a lot, but 2-3 choices which I give to the patient, and all of them make sense. It's mostly the patient's decision. For example, knee replacement. Sir, how do I give them the correct choices without giving them the bias?
Yeah, it's extremely important to not be biased. So one very simple way is go back to Chairman's logic. What would you do if it was your mother? What would you do if it was your brother? So visualize yourself in the patient's shoes and say, okay, I've got all the information. This is what I would do. Now, I'm not trying to say out here that you have to make the decision, because sometimes patients ask you and say, doctor, what would you do if it was your father? Now, that is a very tricky one, and you can't really get into that and answer that, because the social circumstances, different, parameters come in. But try and visualize how would you want to hear that information if you were sitting across the table. It'll help you. And that bias has to definitely be avoided. Our job is to lay out all the options. What are the pros? What are the cons? For everything, there's a positive. For everything, there's a negative. Lay it out. And never, never, ever say to a patient that you have to decide now. Always tell them, think about it. I've laid the information in front of you. Once you've had a chance to think about it, come back. One of the things that people will learn once they're in practice is the moment you push something, people feel, why is this person pushing? Is there something else that is at the back of their mind? Is there a bias to do this procedure? So always give people time, let them think, let them come back.
Sir, you have written a lot of books and you have a lot of publications as well. Sir, can you briefly tell us about some of the books you have written?
So there is one textbook that I edited on pediatric gastroenterology and hepatology. The second edition is going to come out later on this year.
Okay.
Then co-edited a book on quality called Qualitonomics. And then I wrote a book which is called Is Your Child Ready to Face the World? That's on parenting, and that's based on what I learned as a pediatrician, seeing parents interact with their children. And it really talks about how to communicate with this present generation of kids.
Right.
How is it that you can actually break that barrier that tends to develop because of the generational shift? And it's largely from our parents' perspective on how is it that they need to learn some of the finer points of parenting to be able to connect with their children. But it is also a book about self-improvement and commencing on a self-improvement journey. Because once you're a parent, your entire perspective towards life changes. So that's on parenting. And then we're going to be coming out with a book which I've co-authored on liver transplantation called Transplanting Hope. That is about 25 stories out of the nearly 600 pediatric liver transplants that we've done, which are moving stories about fighting death and about perseverance and struggles. Wow. So that will come out later on this year as well.
Sir, what's easier to write, a publication or a book?
Well, clearly a publication, because the amount of writing stuff is much lower, but much lesser. But of course, the research per se, in terms of the data analysis and all, is more complicated. So I think it would obviously takes less time to write a paper than it does to write a book.
So, sir, let's quickly take some rounds. I called it rapid rounds. So you have to answer in short, probably a word or a sentence.
Sure.
So your favorite book?
I don't have one favorite book because I read a lot of books on self-improvement. But I would read some of the books by Dale Carnegie, especially for everyone in medicine. How to win friends and influence people. I think 100-year-old book, but truly remarkable and a lot of value in that book.
Sir, if you have a time machine and you could visit any era of medicine, which era would you like to go back to?
Well, it's interesting in that maybe go back 30, 40 years when we didn't have so much technology, and people used more and more of clinical examination in history to arrive at diagnosis. That would be fascinating.
Sir, one habit that you wish every doctor learned early in their career.
Figure out your daily schedule in terms of discipline. It's extremely important. I'm not saying it's 8 hours of sleep or 6 or 7, but you must wake up at the same time, sleep at the same time, eat at regulated times, drink a fair amount of water, and get a discipline. How many hours of work, this much time for social media and so on, this much time for reading, physical activity. Get disciplined. Anyone who's successful in life is disciplined. And that goes without saying. I'm not saying you have to get up at 5 a.m., but whatever time works for you, but it has to be, your body cannot handle. As it is in medicine, we have night duties and so on. So it's pretty challenging. But you have to get back into that discipline just as you finish your night duty, because it's extremely important. Body cannot handle these too many variations.
So if you could have dinner with a medical pioneer, who would it be? Anyone?
Well, I think perhaps Christian Barnard, the person who did the first heart transplant.
Wow.
Quite fascinating, his life story and all that he did in terms of innovation.
So one innovation in healthcare that excites you the most?
Well, I think the fact that we are going to keep patients out of hospitals is going to be exciting. Using technology, using predictive models, using AI, using ML, using non-invasive monitoring. The fact that we can keep people out of hospitals and at home would, I think, to my mind, rank as the topmost.
So one thing you would be doing if not medicine?
I think I would have been in television. I really enjoyed, maybe I would be reading the news or be an anchor.
Yeah. So 3 words that describe Apollo.
I think putting patients first. That is part of our DNA.
Wow. Very well said, sir. And thank you so much for this insightful podcast. Thank you for coming.
And, as I go, I would just remind all our young colleagues who are entering the profession or are in an advanced stage of training, is that as you go out and become very successful in what you do, remember to be humble, remember to be down to earth, remember that whatever you're doing is not just for your own good and for your own success, but it's about someone who's placing their trust in you. So do not let your qualifications, your experience, your success go to your head. Right. And I read this and it was written, किसी के कब्र पे लिखा हुआ था, मैं अहम था, यही वहम था. And I try and remember this every day. So मैं अहम था, यही वहम था. Don't ever think that you've been super successful and the world will function, cannot function without you, because it will. At the end of the day, we are here just for a bit. Do our best and move on. And don't expect too much in terms of that people are going to remember you for your great work. While you're there, do your great work or whatever work you think is great and move on. Don't take life too seriously. Don't take yourself too seriously.
Thank you, sir.
Right. Thank you.
So guys, if you like this podcast, please press the button like, share it with your friends and family, and subscribe for more such content. Thank you.